Hey, everybody, welcome to another deep dive. Today, we're going to be looking at nursing.
Yeah.
We've got this really cool report from the Life Skill Foundation.
Really is a fantastic report.
Yeah, and it's all about kind of like charting a career path for aspiring nurses.
And they've gone above and beyond to make it specific for students in India.
That's awesome.
So if you're in India listening to this,
Yeah.
this is for you.
Okay, so
It really is.
first of all,
Yeah.
Life Skill Foundation.
Yeah.
Who are these people?
So they're based out of Ahmedabad.
Okay.
They've been around since 2011,
Okay.
and they're all about empowering young people.
Oh.
And they're doing that by getting them the information they need to make good decisions about their careers.
So no more like blindly going into whatever your parents tell you to do.
Exactly. This
Yeah.
is all about making informed choices.
But why nursing?
Oh.
Like, why focus on that?
It's a huge field right now,
Okay.
and it's only growing,
Okay.
especially in India. You've got a growing population, which means you've got a greater need for healthcare.
Makes sense.
So it's just supply and demand.
Right.
But it's more than just filling positions.
Right.
It's about inspiring people who are passionate about caring for others.
Oh, so they're really trying to like light a fire
Exactly.
under people to go into this very important field?
It's important work.
Yeah.
Yeah.
So
Yeah.
what does the report say about what nursing actually is?
Right off the bat, they say nursing is about caring for individuals,
Mhm.
families,
Yeah.
entire communities.
Wow.
It's a blend of medical expertise,
Okay.
but also emotional support.
So it's not just like the technical stuff.
No,
You got to have the human touch.
you got to have the human touch. And they really emphasize that.
Okay.
It's about caring for the whole person.
So more than just bandages and taking temperatures.
Way more.
Okay.
Although those are definitely part of it,
Right.
of course. But they stress that nurses are educators,
Okay.
advocates.
And critical thinkers.
Wow, so you got to use your brain.
Absolutely.
Losing this job.
You're not just following orders.
What?
You're thinking on your feet.
Wow. I'm already impressed by this.
You too.
But honestly, I'd probably faint at the sight of blood.
Yeah.
So this is not a career for everybody.
Not for everyone.
Does the report talk about what kind of person would be good at this?
They do.
Okay.
They mentioned something called the Holland Code.
What's that?
It's kind of like a personality test for careers.
Oh, interesting.
And it turns out that people who fall into the social category
Okay.
often excel as nurses.
Social, so like the friendliest people you know,
Exactly.
the life of the party,
Yeah.
they would be a good nurse.
Think empathetic, compassionate, incredible communicators.
Okay.
Those folks tend to have the natural instincts that make a great nurse.
Yeah, you need more than just the medical knowledge.
Absolutely.
You got to be able to like connect with people.
Yeah, especially when they're going through a tough time.
sorry.
Exactly. Okay, so that makes a lot of sense.
Yeah.
So within nursing, you've got options, right?
Oh, yeah. Tons.
Okay.
The report breaks it down like a ladder,
Okay.
starting with entry-level roles like nursing assistants.
Okay.
Think of it as dipping your toes in the water.
So you could start with a diploma or some kind of training program.
Exactly.
Okay.
And then if you're ready to climb that ladder,
Okay.
a bachelor's degree in nursing is usually the requirement to become a registered nurse.
The classic RN.
That's the one.
Everybody knows that.
Everybody knows the RN.
All right, so those are the folks that are really in the thick of it.
They are.
Yeah.
They're on the front line.
And it doesn't even stop there.
No, it doesn't.
You can go beyond being an RN.
You can specialize.
Okay.
You could focus on pediatrics,
Hmm.
geriatrics.
Okay.
You could even go for your master's degree to
Wow.
become what's called an advanced practice nurse.
Okay, now you're just getting fancy with the titles.
I know, right?
What is an advanced practice nurse?
So that opens up even more doors.
Like what? Give me the fancy titles.
One example is a nurse practitioner,
Oh,
and they often have more autonomy.
okay.
They can provide primary care, and in some cases, even prescribe medication.
Wow, they can prescribe medication.
I know.
That's a lot of responsibility.
It is. Okay, so
Big responsibility.
the report lays out this very clear progression
It does.
from entry level all the way up to
To the top.
the top, what you call an advanced practice nurse.
Advanced practice nurse. That's the one.
I got to remember that.
It's a mouthful.
But let's get practical for a second.
Okay.
What does it actually take to get there?
Right.
What should someone be doing right now in
Yeah.
high school,
Yes.
if they're even remotely considering this?
Get ready to hear this a lot. Science is key.
Okay.
Biology, chemistry. Those are your building blocks.
Makes sense.
The report really stresses a strong foundation in science.
You got to understand the body before you start.
Exactly. You know, poking it with needles and stuff.
You got to know what you're doing.
Okay, but after high school, then what?
Okay, so according to the Life Skills Foundation,
Mm-hmm.
they suggest that after you finish 12th grade,
Okay.
you have options.
Oh, good. I like options.
Me too.
What are our options?
One common path is the 4-year Bachelor of Science in Nursing,
Okay.
the BSc Nursing,
So that's like the classic route.
the classic route.
Okay. Are there other options, though?
There are.
Okay.
For people who maybe aren't ready for the 4-year commitment,
Right.
they highlight a 3-year diploma in nursing.
Okay.
It's a shorter program.
Okay.
Still equips you with those practical skills.
So you can start working sooner.
Exactly.
Okay.
Or if you want to specialize
Mm-hmm.
right from the get-go, there's the 2-year auxiliary nurse midwife course,
Oh, wow.
the A&M.
Okay.
If you're passionate about maternal and child health,
Oh, that's amazing.
that's the one for you.
Delivering babies.
That's it.
So cool.
Yeah.
Okay, so many choices.
So many choices.
That's awesome.
Isn't it great?
It's great that they lay it all out, though.
Yeah, they really break it down.
But let's say, okay, you've gotten your diploma.
Okay.
You're ready to work.
Mhm.
What does a typical day even look like?
Yeah.
Like, is it all hospital gowns
Right.
and beeping machines?
Is it all Grey's Anatomy?
Yeah, exactly.
Okay.
Well, there's definitely a lot of that.
Okay.
But the report gets into the nitty-gritty
Okay.
of a nurse's responsibilities.
Okay.
And it's way more diverse than you might think.
Okay. Spill the tea.
Uh-oh.
What do nurses actually do all day?
Think of it like you're the eyes and ears for the whole medical team.
Okay.
You spend a big chunk of your day monitoring patients, vital signs,
Okay.
checking for changes, making sure everything's running smoothly.
Okay, so attention to detail is huge.
Huge. You can't miss a beat.
Yeah.
And it's not just observing, you're documenting everything
Oh, okay.
meticulously.
Think of it as detective work.
Oh, okay.
You're gathering those clues to help the doctors make the best decisions for the patient.
I like the medical detectives.
There you go.
So we've got the monitoring, the documenting.
Mm-hmm.
What else?
And there's the hands-on stuff.
Oh.
Administering medications, giving injections,
Yeah?
assisting doctors during examinations,
Mm-hmm.
even in surgery.
Wait, nurses are in the operating room.
Oh, yeah.
Really?
They're a crucial part of the surgical team.
Wow. I had no idea.
Yeah, making sure everything runs smoothly.
Okay.
But it's not all about the medical procedures either.
Okay.
The report also highlights how much nurses do to educate patients
Oh, right.
and their families.
So they're not just treating the illness.
Right.
They're actually teaching people how to manage their health.
Precisely. It's about empowering people to take control of their well-being.
That's amazing.
And nurses play a huge role in that.
Okay, so you're telling me nurses are basically like medical superheroes
Yeah.
who can also teach you how to take care of yourself.
That's a great way to put it.
I'm sold.
I know, right?
Where do I sign up?
But it's not always easy.
Right.
And the report's upfront about that.
Okay.
Long hours,
Yeah,
demanding patience,
I bet.
sometimes dealing with really difficult emotions.
Yeah, that takes a special kind of person
It really does.
to handle all of that.
And to handle it with grace and compassion.
Okay, so resilience is key.
Absolutely.
You got to be able to handle the tough stuff without losing your cool.
And that's where those social skills we talked about really come into play. Being
Right.
able to connect with people, offer comfort,
Mm-hmm.
be a calming presence, even in stressful situations.
So it's not just about being book smart.
No.
It's about having emotional intelligence, too.
Absolutely. It's about using your head and your heart.
Okay, so on a more practical note,
Okay.
let's talk about the elephant in the room.
All right.
Salary expectations. Does this dream career actually pay the bills?
Right. Because those student loans aren't going to pay themselves.
Exactly.
So the report says it can vary, obviously, depending on experience, location.
Mm-hmm.
But here's the good news.
Okay.
It's a growing field.
Okay.
The demand for skilled nurses
Yeah.
is only increasing,
Which means,
which means more leverage to negotiate.
yes. I like where this is going.
Right? Higher salaries.
So the more specialized you become, the more valuable you are.
Exactly.
Supply and demand.
Right.
But beyond the paycheck,
Okay.
the report highlights something even more valuable.
Oh, don't tell me it's paid vacation time.
Okay, it's not paid vacation time.
Although I wouldn't say no to that.
Wait.
But, okay, what is it?
We're talking about job satisfaction.
Okay.
That deep sense of fulfillment
Yeah,
you get from knowing you're making a real difference in people's lives.
that's true.
Yeah,
I mean, how do you measure that, though?
because that sounds pretty priceless.
It is priceless.
Yeah.
It's about those moments when you help a patient through a difficult time,
Yeah.
or when you see the relief on their face when they start to heal.
Oh, yeah.
It's about being a source of support and hope when they need it most.
Wow, I can see how that would be incredibly rewarding.
It is.
But let's say someone's intrigued by healthcare,
Okay.
but maybe not sold on nursing.
Sure.
Does the report have any suggestions for those people?
Absolutely.
Okay.
They've got a whole section on related careers that might pique your interest.
Okay, hit me.
So we already talked about nurse practitioners.
Yeah.
But there's also midwifery,
Okay.
a field focused on pregnancy, childbirth, postpartum care.
So bringing new life into the world.
Exactly.
That's right.
If you're passionate about women's health, that's a really rewarding path.
What else is on the list?
How about physician assistants?
Oh.
They work closely with doctors,
Okay.
assisting with exams, diagnoses, even developing treatment plans.
So they're like the doctor's right-hand man.
Literally.
Okay, I can see how that would be super interesting,
Yeah.
especially if you're into like the more analytical side of healthcare.
Absolutely.
Anything else?
If you love the idea of education and prevention, maybe a health educator is a good fit.
Okay.
They teach people about healthy habits, disease prevention,
Okay.
how to navigate the healthcare system.
So kind of like a health coach for the community.
Exactly.
I like that.
Yeah, and then there's medical social work,
Okay.
focusing on the social and emotional aspects of health and illness.
That's a really important aspect.
They advocate for patients' needs.
Okay.
They connect them with resources,
Mm-hmm.
provide support during tough times.
Wow. It's amazing how many different paths there are within the world of healthcare.
I know, it's incredible.
But let's circle back to nursing for a sec.
Okay.
This report's been super insightful,
It has.
but I bet some of our listeners are thinking, okay, this all sounds great,
Yeah.
but where do I even start? Like, what's step one?
You're reading their minds.
Yeah.
And lucky for them, this report doesn't just drop a bunch of information and leave them hanging.
Okay, good.
They actually provide a step-by-step guide
Awesome.
on how to get started,
Okay.
starting with what to focus on while you're still in school.
Okay, so besides acing those biology exams, what else should aspiring nurses be doing?
So they emphasize understanding medical terminology.
Makes sense.
Right.
You're going to be swimming in medical jargon.
Exactly. You don't want to be the only one in the hospital who doesn't know what stat means.
Right, exactly.
So having a solid grasp of the language is crucial.
But it's not just memorizing words.
No.
You got to understand the concepts behind them.
Exactly.
Okay.
Then there's patient care.
Okay.
Knowing those fundamental nursing procedures,
Okay.
understanding patient needs,
Mm-hmm.
providing compassionate care.
So it's the hands-on practical side of things?
Precisely.
Okay.
And you can't forget pharmacology.
Oh, yeah. That's a big one.
That's all about medications.
Right.
Their effects,
Yeah.
how to administer them safely, a critical part of nursing.
That's why they have whole courses dedicated to this stuff.
Exactly.
Okay.
Speaking of courses, the report outlines a potential education roadmap,
Okay.
even for those who are still in 10th grade.
Perfect timing. I'm sure we have some eager beavers listening in who are already planning their future.
I'm sure we do.
Okay.
So they suggest focusing on those core science subjects,
Okay.
biology, chemistry, to build that strong foundation.
Science is your friend.
It really is.
Okay.
Then, after 12th grade,
Mhm.
they suggest a few paths.
Okay.
Talked about the 4-year Bachelor of Science in Nursing,
Yep, the classic route.
the BSc Nursing,
Mm-hmm.
but they also highlight that 3-year diploma in nursing,
Right.
a shorter program focused on those practical skills.
So a little more flexibility there.
Exactly.
Okay.
And if you're set on a specialized path, there's that 2-year auxiliary nurse midwife course,
Right.
the A&M,
The A&M.
ideal for those passionate about maternal and child health,
Delivering baby.
delivering babies.
Okay, so many options. It's almost overwhelming.
It is, but in a good way.
In a good way.
Yeah.
Like you have choices.
You have choices.
That's awesome.
Isn't it great?
They really have thought of everything.
They really have.
Okay.
And to top it off, they even recommend specific colleges.
Okay, give me the Ivy League of nursing schools in India.
All right, so right at the top,
Mm-hmm.
All India Institute of Medical Sciences,
Go ahead.
AIIMS, in Delhi.
Oh, yeah. Ames, that's a big deal.
That's a big deal,
that's-
known for its excellence.
Ames is top-notch for everything medical.
It really is.
Okay.
Another strong contender, Christian Medical College,
Okay.
CMC in Vellore,
CMC, okay.
another highly regarded institution.
Okay, so Ames in Delhi, CMC in Vellore.
Those are some high bars.
Yeah, those are some high bars to reach for.
They are.
Those are not the only options, right?
No, not at all.
Okay.
They also list what they call Tier 2 colleges.
Like Chem Hospital in Mumbai,
Mm-hmm.
Manipal College of Nursing.
Okay, so even if you're not in Delhi or Vellore,
Yes.
there are still some great options out there.
Absolutely.
Okay.
And don't overlook those Tier 3 institutions,
Okay.
like government nursing colleges.
Right.
They often offer great education.
Yeah.
That's more accessible cost-wise.
That's really important to remember. Not everybody has the same opportunities,
Exactly.
resources.
Okay.
So it's good to know that there are options.
There are options for everyone.
Yeah, no matter what your circumstances.
That's right.
Okay, and then for those who maybe want to specialize further or gain additional skills, what do they recommend?
Online courses.
Oh, right. Online learning is huge now.
It's huge.
And for good reason.
It's amazing you can level up your skills from anywhere in the world.
From your couch.
Exactly.
In your pajamas.
Love it.
Okay, so...
Coursera, Udemy,
yeah.
all those platforms.
So they'll have something to offer.
So many platforms offering specialized courses these days. It's pretty incredible when you think about it. You can literally become a nurse from your living room.
I know, it's amazing.
Okay, I think we've covered a lot of ground here.
We have.
From what nursing actually is
Yeah.
to how to make it your reality.
Step by step.
But there's one more thing I'm curious about. The report keeps mentioning these abilities that are crucial for nurses. Not just skills you learn in the classroom, but personality stuff, right?
Yeah.
What's the deal with that?
Yeah, it's so important. And it often gets overlooked. You can have all the knowledge in the world, but without these abilities, you're not going to thrive as a nurse.
Okay, so what are these must-have qualities? Give me the secret sauce.
Number one, and the report is very clear about this physical stamina.
Okay.
We're talking long hours, often on your feet, dealing with patients who need physical assistance.
Yeah, you got to be strong to be a nurse.
You got to be strong.
Okay.
Then there's attention to detail. This one is non-negotiable.
Okay.
Nurses are responsible for observing their patients, noticing subtle changes, documenting everything accurately.
Yeah. It can literally be the difference between life and death.
So sharp eyes, keen mind, and probably a good memory.
Absolutely.
To keep track of everything.
And finally, something that's essential in any healthcare setting, teamwork.
Oh yeah, you can't be working in a silo.
Nope.
You got to be a team player.
The report actually dedicates a whole section to this.
Yeah.
It talks about how nurses are constantly collaborating with doctors, technicians, other nurses. It's about communication, listening, working together towards a common goal, the patient's well-being.
So you need to be able to listen to other people's opinions, even if you don't agree.
Exactly.
And put the patient first, always.
Absolutely.
Wow, this has been so eye-opening. I always knew nurses were amazing,
Yeah.
but I had no idea how much went into it.
It's a lot more than people realize.
It is.
But it's so rewarding.
Yeah, and this report from the Life Skill Foundation really does a great job of
It does.
capturing all of that.
It really does.
Ta-
So for anyone listening who's thinking, okay, this sounds really cool, I want to do this.
Yeah.
What's their first step?
Well, they don't just leave you hanging.
Okay, good.
They tell you exactly what to do.
Okay.
First step, reach out to them.
The Life Skill Foundation.
To Life Skill Foundation.
Okay.
Their contact information is in the episode description.
Easy peasy.
Ask them questions. Start exploring.
You don't need to have it all figured out today.
Yeah, just reach out.
Just take that first step.
Exactly.
Awesome.
And who knows, maybe someday you'll be the one inspiring future nurses,
Yeah.
sharing your own experiences.
I love that.
It all starts with a spark.
This has been fantastic.
Yeah.
Thank you so much for joining us and walking us through all of this.
It's been my pleasure.
And for all of you listening out there, thanks for joining us on another deep dive into the working world. We'll see you next time.